Welcome to Motherhood Aligned and Assigned, where we help guide mothers from symptoms to solutions.
We're Dr. Serena Coffman and Dr. Veronica Schiltz, nervous system specialists helping families discover the missing link in their wellness journey.
Join us as we translate complex health challenges into simple, actionable solutions for you and your children.
Because your family deserves to thrive,
not just survive. Okay, so something I've been experiencing a lot in the office recently is helping babies transition in their milestones from especially crawling to walking or just walking in general. And so one of the things I've actually had parents do, and it's kind of funny because sometimes they're like, oh, they just, they just so happened to start crawling and walking while we were in the office with you, thinking that it's just something that's going to happen naturally. Maybe that's what this conversation is going to be more about, is that, if your child is skipping milestones, sometimes I feel like we've all been trained to believe that it'll just happen eventually. And that's just not actually how it works. And the cool thing is that we have babies who can't crawl, who are now crawling, who then go into walking. And I think a lot of the parents are just like, oh, that's just is how it happens. But it actually isn't. It's not that. Usually a child is going to skip their milestones because their brain is too overwhelmed to go back and fix it unless you have chiropractic care to help you. So I'm almost thinking that I need to let my parents know, like, hey, this actually isn't normal for them to actually go back and solidify their milestone, because we've just been taught as a society to just watch and wait and eventually it will happen. But what's happening is that we watch and wait, they skip their milestones, and then you have adults who grow up who don't have any hand-eye coordination because they skipped their milestones and started walking at 9 months old. So I just maybe want to talk about this episode of if your child is skipping milestones, or if you're concerned about milestones, or if you have questions about milestones. We're going to be talking about that and why neurologically it's so important.
All right, so you're talking about, Dr. Veronica, like the first year of baby's life, and that a lot of babies transitioned from crawling to walking around that 1 year mark. But you said you also have babies that are struggling to transition from not crawling to crawling.
Yes.
Yeah.
So we're kind of, in that, I would say around the 1 year mark where we're trying to get baby to start walking. And then also around the 6-7 month area where we're trying to get baby to go from army crawling. We have a lot of army crawlers. Army crawling to actually getting those knees under, pushing up with those shoulders, and crawling in that pattern.
Yeah. So that first year of life is the craziest development for our brain, right? So the brain doubles in size. Harvard calls it the most neuroplastic window of a child's life. Maybe even in the womb is even more neuroplastic than that, which we've talked about before. So milestones, for parents listening, are more than just a check box to check off, right? Milestones are, chiropractors are viewing them as primitive reflexes that we have to integrate so that you can level up to the next more complicated neurological functions, foundation building blocks. And you cannot pass go correctly unless you can meet this milestone and integrate this process in your brain. For example, lots and lots of kiddos, if they don't crawl, so they don't do this cross crawl pattern, where one leg and hand are kind of crossing each other. There's this cross-body movement, in a sense, a coordination. That is connecting the brain. It's asking one side of the brain to talk to the other side of the brain. And that's huge in our neurodevelopment. And it's strongly related with our ability to eye track when we're reading. So a lot of kids who don't crawl and they skip that have trouble reading later on in life. And it gets misdiagnosed as ADHD because they can't focus because it's an eye tracking issue, right? Your eyes can't track from left to right smoothly. And so then it's really hard to focus on a page, and then you just give up and move on and do something else that you're good at, right? Oh, and they're ADHD. It's no, or how good are they at eye tracking? Or it gets misdiagnosed as dyslexia, or they just think they're bad at reading. So that is an example of how primitive reflexes or milestones are correlated with our neurological development that impacts us in the future, and why we care about it so much.
Yeah, and I feel like that was such a good example, Serena, because I feel like there's a lot of people who are like, what does my child reading have to do with chiropractic? And you just literally explained how if you're not getting adjusted and your nervous system isn't functioning properly in the beginning, it's not like I think what we have been trained to believe is that it's just like, oh, you grow out of it and it'll go away. But really, it's just that your brain no longer has that foundation, and now it's building everything else on top of a shaky foundation. And now you have behavior, now you have reading issues, now you have trouble focusing, now you have autism, now you have ADHD, right? Not that those things aren't legitimate diagnoses, but a lot of the time, like Dr. Serena said, it's a misdiagnosis of what is truly just dysfunction in the nervous system that was never properly developed in that first year.
Yeah. And actually, something I just thought of is, okay, so seminars I've gone to about integrating primitive reflexes, awesome. But this chiropractor in specific, who's like really, really, really good at integrating primitive reflexes, maybe has a different viewpoint than Dr. Tony Ebel, PX Docs, where Dr. Tony is like, hey, it's like, I've gone down that road of like lasers and like focusing hardcore on primitive reflexes. And he's like, actually, if we just focus on the nervous system, that's going to take care of a lot. And I just put it together. So this kid who is struggling to read because he didn't crawl appropriately or at all. Well, it's like, okay, go even further. Why didn't he crawl appropriately? Right? Like there was nervous system dysfunction. We can call it dysautonomia, like improper subluxation, like noise and stickiness in the nervous system that didn't allow him to move the way he needed to move, like brain-based wise, not just like muscles were stuck. And that noise is still there when he's trying to do school stuff. So it's more than just eye tracking. It's like also how much other noise is in his brain. That's not just like he can't track his eyes across the page. There's also all of that stuckness and stickiness is still there and has built up over time. Mm-hmm. So that kid probably maybe does have ADHD in addition to eye tracking problems. Anyways, that was just an epiphany I had sitting right here. Actually, it's like, it's more than an unintegrated primitive reflexes. Why wasn't that integrated in the first place?
Yeah, and I think that primitive reflex talk is really important because there are a lot of chiropractors, and I've even had people be like, do you focus on primitive reflexes? And I am like, not in the way you think we do, right? Because it just, and I will say, I don't probably have enough knowledge to make a full statement on this, but to try and integrate something that did not integrate through movement when you couldn't move in the first place. Like, I get the concept of being like, okay, well, it's not moving, so let's add movement to it, but that's not, we don't do that from an outside in approach. We should do it from an inside out approach, right? Because that's where the root cause of the issue was in the first place. So yeah, I mean, you could go to a PT, and there are times that, if it's been long enough and there's enough noise and there's enough dysfunction, and however the child is adapting or not adapting, right? If that's been long enough, you may need a PT down the road. But again, not addressing the stickiness or the loudness within the nervous system, you are essentially just bringing more noise to that child who needs a release of noise first before he or she starts to make sense of the information you're trying to give him or her.
Yeah, they were designed to integrate reflexes. And so why didn't it happen, right? Like to force the crawl motion, it doesn't do anything. Mm-hmm. Or it's going to take a really, really, really long time to like kind of force a motion that the brain is like, hey, I didn't have the resources to do this in the first place, right? So chiropractors get to remove the stress from the system, remove the blockages from that information clicking the way it needs to click, so that PTs and OTs are the ones who work a lot with primitive reflexes, can shine and look super cool. Because they're like, yeah, your kiddo, this was going to take a year, and it's only taken like a month, literally. Yeah.
Yeah. And it's hard when you've got moms and dads coming in who are like, well, I don't, let's say there's constipation or behavior or all this stuff. And it's like, you have been watched by a pediatrician that child's whole life almost, right? It's like every couple months you see them. And it's so interesting how other providers are not trained to become aware of that why. Like Dr. Serena said, like, why are we not hitting milestones? And instead we're just like looking at when we hit milestones. And so we have parents come in being like, well, I've been taking them to the pediatrician. Like, I don't understand. And this was like it feels like it came out of nowhere when we have other issues, because we weren't paying attention to the milestones that were taking place, because we were just looking at when they happened, and we weren't necessarily looking at how they happened or the quality of what was going on. And so, an example of this is a baby might roll over on time, but do so asymmetrically. So we might only roll over to the right. And so we have parents who are like, woohoo, we have a baby that rolls over, but they only roll on their right side. And then all of a sudden, when that becomes a problem and we have a child who is struggling to walk, right, because maybe that one-sided rolling didn't support the coordination the baby needed to walk, then it's like, oh, well, my baby's not walking. That's weird. She rolled on time, but she isn't walking, right? Mm-hmm. And it's like, well, what was the quality of that? What is the symmetry of that, right? How did that happen? What else was going on during that time? So yeah, I think it's like, we think of milestones as one, exciting and celebratory. It's really exciting. But we need to start looking at the quality and the symmetry of those milestones, because that's going to give us a lot more insight on how well that baby's going to grow up to function and be efficient in his or her movements.
Yeah. And it often starts, we see signs before all of this too, right? So like the early signs of the nervous system might not be communicating as clearly as we want it, are nursing. That's like the number one thing. Like, how many babies right now, like lactation consultants are booming because there's so many babies that are struggling to nurse, of like a really poor latch, tongue ties, lip ties, not opening wide enough, incoordination of that suck, swallow, breathe, reflex. Before that, it's like, well, how was your pregnancy? How did birth go? Right. So that's why we're asking all these questions all the time. It's like, where are the physical, chemical, emotional stressors that came into this baby's life? And then the first things that they need to do are eat, sleep, and poop. And so many babies are like, yep, struggling to nurse and to latch well, not pooping well, not sleeping well. It's like, those are literally their 3 jobs. And those are like huge nervous system function jobs that we have to get online. And when we get to care for our baby and like take care of these things right off the bat, the rest is like good to go. Mm-hmm. Yeah. Although I say that, there are chiropractic kiddos, and those are like kiddos that like their moms and dads are chiropractors, and we're like on it all the time. Well, maybe not as much as to the best of our ability. And they develop some wonky crawls that we have to work through, right? So Hadley did a wonky crawl, but actually I went to the primitive reflex seminar, like done by a chiropractor, and implemented one move to like integrate this reflex and adjusted her, and she literally that night started crawling correctly. It was really cool. Duke army crawled, like scooted for a long time.
I swear it's the chiropractors kids that are always
yeah.
Isaiah had an ear infection earlier this year. I was like, are you what?
This is not allowed.
What's going on? Yeah. So it just goes to show that obviously we don't live in a perfect world. Even with chiropractic, there are times. But I think the thing we're trying to say is that like making sure you have that foundation sets you up for so much more success. Because imagine if this is going to happen, if life's going to happen anyway, if your child could have these issues anyway, you want to make sure they're as adaptable as possible to get through them. And that's why starting earlier is the best possible thing you can do for your child, is because things do happen and you don't know, you can't be prepared for everything and you can't prevent everything. But if they have an adaptive, functioning, efficient nervous system, they're going to be able to get through it a lot.
Yeah.
More efficiently.
Yeah. Yeah. Like, could Hadley have just picked up that information I gave her and started crawling the second after I did those motions to try to integrate that reflex if she hadn't have had a regulated nervous system before that? Probably not. Like, that was not in the plan. Like, how long? Oh gosh, I can't think of this doc's name. He's like, yeah, it's going to take a few visits to like integrate this, and she did it right away, right? So like the work had been done and she just needed help. And this is where the OT comes in. It's like, okay, the nervous system work had been done, and then the OTs are really good at integrating the information so that the body can use it and remember how to like basically use the map it's been given, right? We're cleaning up the map, and then the OTs are telling our brains like, hey, you can use this correctly now. Remember that you can do this. Yeah.
Well, I still think it goes back to episode 2 or 3 where Dr. Serena, you had mentioned, so many other things are focused on the cortex, and we focus on the amygdala, right? And well, both, right? But that kind of like in that scenario with Hadley, it's like we knew that her brain was able to function, and the organization and informational processing part of the brain was working at a high rate, where she got the information, she integrated it, right? And what a lot of kids we're seeing is where they're stuck in that sympathetic fight-flight mode. Their awareness and understanding and processing of information is not working as efficiently as it could. So now you have a lowered sense of information, right? Your body's ability to integrate information, and then a heightened sense of ignoring all sense, right? Like your fight-flight response is really just like primitive, like exactly what we call it, fight-flight. And so when that's like this, you're gonna have a OT come in and they're gonna fight you every step of the way because they're already not paying attention to anything that makes sense, right? And so chiropractic goes like this and makes them work together so that when that OT does come in, they get to excel. And I think that's one of the coolest thing about being this kind of chiropractor. I don't know, I feel like some chiropractors are like claim the fame for all things. We just say that we know the nervous system really well, and we want everybody else to just be better at their jobs. So we really just get to help parents, we get to help providers, we get to help everyone in this lane, because we stay in our lane and we help them with that adaptability, and everybody else gets to look better because of it. And so I think that's another really cool part about our job.
Yeah. Okay, let's backtrack and just really put a stamp on like how our kiddos getting to this point. I mentioned it a little bit a few minutes ago, but why are kids missing milestones? Why aren't they nursing well? Why do they grow up and are becoming like neurological challenges like ADHD, autism, those kinds of things? Do you want to run us through what we'd like to call the perfect storm?
Yeah, so you have a mom and a dad, and oftentimes, especially nowadays, struggling with fertility. So getting pregnant has been a little bit more stressful. So it really starts at conception. And then you have the same parents who are now pregnant, but now stressed through that process and going through stressors in day-to-day life, right, through pregnancy. Very, very uncommon to hear about someone not having a stressful pregnancy in some way or shape or fashion. And so you have this mom who's already kind of stressed about how she got pregnant. She's stressed through her pregnancy. She has sometimes interventions for birth, right, because you were already stressed to start with. Birth is a very heavy, like, relaxation time, right, time to learn how to relax those pelvic floor muscles and allow baby to descend and come out. And so if we have a mom who's already stressed out, birth becomes a little bit harder, interventions become a little bit more necessary or introduced anyways, because we already have more interventions than sometimes we need. And then now you have a baby that has literally from the time they were conceived to being born has experienced nothing but stress, and they stay stuck in that stress as a way to kind of adapt to the life around them. Then you have things like colic and constipation and struggle sleeping, right? And so now everyone is stressed going through that newborn process. And then you get through and you grow up to be a toddler who struggles with tantrums and behavior and listening. Now we start to see things like ADHD, even anxiety at that young of an age. That's becoming more and more prevalent. That toddler becomes a child and adolescent who kind of gets more and more into that either anxiety, depression, sometimes both, grows up to be anxious or depressed, ADHD adult, and then we repeat the process. So that is what we call our perfect storm from the time you are conceived to the time you are an adult. This is why we have dysfunctional people walking around, because we've just known stress a majority of our lives more than we ever were supposed to and designed to carry.
Yeah.
And so we take that perfect storm person, right, who has kind of walked with stress their entire lives, and we get to teach the brain how to do things differently. We get to teach the brain how to release that stress for the first time in maybe their entire life.
Yeah. Which is like mic drop, but we'll keep going. Okay, so Dr. Veronica is saying that the emotional, physical, chemical stressors in our environment, they're not just creating symptoms that we're seeing. It's not just like, that's not how it jumps. What's happening is that those stressors imprint on our nervous system. And our nervous system, if it can't process that, has to do something with that. And it stores it physically in our body. And that's how we get subluxation, right? And this is creating obnoxious patterns in our body that are leading to what we see as symptoms, right? That our body's waving this red flag. And we don't want to throw shade at pediatricians. That's not what we're here for. They're not trained to look for this, is the whole thing, right? They're trained to see, because they don't have the tools to fix it, right? This isn't their lane, right? So I don't know. I'm just gonna be blunt here, and I think that our audience who's found us will get it. And sometimes I have to remind parents of this, like taking your child to the pediatrician does not make them healthy, right? Like people are worried sometimes about missing their pediatrician appointments. Like, is the pediatrician creating life in your child by going? Like, are they doing something to keep your child on track for their health and development? No. Like,
just check in.
It's just check it. Like, are they alive? Essentially. And then if they're in bad situations and there's something really big going on that the parent isn't aware of, it doesn't know how to check, like that's different, right? Like they're getting the big things, right? They have so much on their plate that they're getting these like huge cases of like, hey, something really big is going on here, and this is like needs medical attention. And they don't have the capacity, nor do they have the tools to see like, okay, there's some asymmetry in this movement, and there's a lot of stress here that is leading to these issues. That's our job, right? Like the big stuff is taken care of. Like, is baby safe in their house? Do they have cancer? No, like those big things. We get to check on the details of, is what's going on optimal? I think that's the difference, right? And we have the tools to remove stress from the nervous system so that by design, your body can create an optimal expression of life. We don't do that. Your body does that. Power that made the body heals the body. That's not us. But that's the tools we have, is how do we see what's going on? One, we have our eyes and our hands, right? We can watch how baby moves. We can feel subluxations. But we also have insight scans, which we've talked about a lot on this podcast, but this is a massive tool for us, for both me as a doctor and you as mom and patient, to see what's going on in your body, right? We call it the insight scan. So there's no radiation, there's no pain, totally baby safe. So I always tell people, it's not putting anything into your body. It's just picking up information. I do have some people who are like, Bluetooth, not a fan. Like, okay, well, we got to pick up information somehow. Yeah. So we have heart rate variability that gives us an idea of your body's adaptability to stress. How much is your nervous system getting pinged? And when it's pinged with stress that is or isn't there, how do you respond to that, right? There's two sides to that scan that's picking up information. Then our EMG is picking up on muscle tone or energy or electricity. What's the brain to body connection going on? And then a thermography, which is temperature, is picking up on our balance in our system, right? Our juices flowing evenly. That's kind of how I say that. And this gives us a really whole picture of what's going on. The EMG and thermography are buddies, and we can like tie patterns together really beautifully. And with those patterns, we can look at your nervous system's adaptability with HRV to see, okay, all of this noise and tension, or lack of noise and tension, is correlated to this worn out, stressed out, no brakes are active, gas pedal stuck on nervous system. And that's huge for showing you what's going on in your body, showing you what's going on in your baby's body when they can't tell you what's going on, and creating a really specific care plan to meet your goals. So
not doing the whole 3 times a week and let's see what's going on. We will literally we are listening to your baby or your brain to see exactly what you need, when you need it, and how often.
Yeah, and I tell people, they're like, what do we expect when we're done with this? It's like, well, if I've done my job well at scanning and interpreting the scans and asking you the right questions and creating the care plan honestly without taking your time and money into consideration, right?
Right.
Just being the doctor, right? If I've done that well, if I'm doing my job well, then at the end of this care plan, we should have met your goals or be pretty well darn on the way to meeting your health goals. And sometimes there's hiccups in that, right? Big life stuff or whatever. But we can expect healing and miracles at the end of a care plan, which is really exciting. Yeah.
So, if your baby is struggling with feeding, sleeping, doesn't seem to settle, struggling to walk, struggling to crawl, I challenge you to kind of get curious as to why that could be and set up a free consult with either me or Dr. Serena or any other PX doc in your area and just chat with them. Just see if your child could benefit from this, because you really are setting them up for the foundation, the building blocks for the rest of their life. And it really just starts with one insight scan that can tell you what exactly is going on in their body and brain.
Amazing.
Would you like to pray us out?
Sure. Dear Lord, thank you for the opportunity to serve families and to be the ones that listen to moms who know that something is off and want the best optimal thing for their child. Thank you for enlightening us with the tools and the resources to remove interference from a beautiful design that you created so we can express life to our full potential that you've given us. In your name I pray. Amen.
Amen.
Thank you for joining us on Motherhood Aligned and Assigned.
We hope today's episode helped you connect the dots in your family's health journey.
Remember, this is where nervous system health meets motherhood wisdom.
Until next time, we're Dr. Veronica Schiltz.
And Dr. Serena Coffman, supporting you as you nurture your family's well-being.
Because when you're aligned, everyone thrives.